Question 1. During a routine physical, a nurse assesses a 12-year-old child with a diagnosis of juvenile idiopathic arthritis, JIA. Which of the following complaints by the child is the first priority? C. My hands and knees really hurt all the time. Juvenile idiopathic arthritis, JIA, is the most common type of arthritis in children under age 16. It typically causes joint pain and inflammation in the hands, knees, ankles, elbows, or wrists, as well as in other body parts. It is an autoimmune disease. While all the statements should be addressed, the child's pain must be managed first. Question 2. During his shift in the emergency department, the nurse assesses a 7-year-old boy with fever, vomiting, and seizures. The boy's mother tells the nurse that they have no health insurance. The nurse reassures the mother that emergency services will be provided regardless of the family's ability to pay. This right to treatment is provided by A. The Emergency Medical Treatment Act. The Emergency Medical Treatment and Labor Act, EMTLA, is a federal law that requires anyone coming to an emergency department to be screened, stabilized, and treated, regardless of their insurance status or ability to pay. It's also called the Anti-Dumping Law, enacted by Congress in 1986 as part of the Consolidated Omnibus Budget Reconciliation Act, COBRA, of 1985, 42 U.S.C. Section 1395 dd. EMTLA defines an emergency medical condition as a condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that the absence of immediate medical attention could reasonably be expected to result in placing the individual's health, or the health of an unborn child, in serious jeopardy, serious impairment to bodily functions, or serious dysfunction of bodily organs. Question 3. An 18-year-old boy receives a prescription for tetracycline to treat his acne. The nurse advises him to avoid A. Sun exposure. Tetracycline can cause photosensitivity, which can damage the skin. This antibiotic should be taken with water, 1 hour before or 2 hours after meals. Milk and other dairy products can reduce absorption. Children under 8 years of age should not take tetracycline. Question 4. A nurse is educating the parents of a 9-year-old girl who will be undergoing chemotherapy. The nurse explains that alopecia is a side effect. Which statement by the nurse is most appropriate? A. She should choose a wig that's similar to her own hair now.
Доход которого не достичь обычной работой. $20 тысяч в месяц со стартовым капиталом в $250, казалось бы, абсурд, но я превратил это в реальность. Это то, за что...
It's important for the child to continue looking as much as possible as she always has. A wig will provide her with both a positive appearance and a way to adjust to her hair loss. During chemotherapy, hair often falls out in clumps, creating a patchy baldness that is noticeable. Parents and others close to the child do get used to the baldness, but it can still be disturbing and a reminder of the situation. Question 5. The nurse is caring for a 17-year-old athlete who sustained a basilar skull fracture during a football game. The nurse knows to assess for Battle's sign in 24 to 48 hours post-injury. Where will the nurse observe this sign? A. Ecchymosis behind the ear. Battle's sign is bruising over the mastoid process. It is primarily caused by a type of serious head injury called a basilar skull fracture or basal fracture, which occurs at the base of the skull. And NBSB, according to Johns Hopkins Medicine, it's the most serious and most common type of skull fracture. The danger is from associated injuries to the brain, spinal cord, and blood vessels that run through the skull to feed the brain. Question 6. A neighbor brings her 10-year-old son to your house because he has a nosebleed. After you sit him down, what is the most appropriate way to care for him? B. Lean him forward and gently pinch above his nostrils. To stop a nosebleed, sit down and pinch the soft part of the nose, just above the nostrils. The bleeding should stop in 10 to 15 minutes. Leaning forward while doing this will allow the blood to exit by the nose, instead of down the throat. Tilting the head back can cause nausea. The other two answer options are incorrect. Question 7. A new mother who is learning to breastfeed asks the nurse, "How can I tell if my baby isn't getting enough milk?" Which of the following is an indicator of inadequate nutrition for the infant? B. The baby has fewer than 6 wet diapers a day. An infant who is not getting enough breast milk can become dehydrated, evidenced by the infrequent wet diapers. The other options are all normal for a newborn. Question 8. Before postpartum discharge of a Latina mother and her healthy newborn, the mother tells the nurse that she will soon begin to feed the infant cured foods. The nurse recognizes that the most likely reason for this is A. The mother is following her cultural beliefs. Studies show that Latinas are more likely not to exclusively breastfeed or give formula. They are also more likely to introduce solid foods earlier than current guidelines. There is a cultural tendency to see chubby babies as healthier and stronger. The nurse may not be able to affect the mother's practices at this time. However, the nurse can offer as much education as possible. The nurse can also explain some risks of offering solid food early, including choking and childhood obesity. Question 9. Parents of a 9-year-old girl with a new diagnosis of type 1 diabetes, T1D, ask the nurse what caused their daughter's disease. The nurse knows the pathology is B. Pancreatic beta cell destruction. Insulin is produced by the beta cells in the pancreas. If the beta cells are destroyed, no insulin will be available. It must be provided by a source outside the body. The other choices are incorrect. Question 10. Before their discharge to home, the nurse is educating parents of a neonate with bilateral club feet. The nurse tells the parents that the infant will be treated with the Ponseti method. Which of the following statements about this method is correct? B. The infant will get a weekly cast for 12 weeks. Clubfoot is the common name for congenital talipes equinovarus, CTEV. Because a newborn's bones, joints, and tendons are very flexible, treatment of clubfoot usually begins in the first week after birth. The goal of treatment is to improve the way the child's foot looks and works before the child learns to walk, in hopes of preventing long-term disabilities. The Ponseti method is the most widely practiced technique for initial treatment of infants born with club feet. It yields excellent short and long-term results. The infant undergoes weekly manipulation and casting of the foot or feet for 12 weeks. Each cast holds the foot or feet in the corrected position, allowing for gradual reshaping. The final cast remains in place for 3 weeks. The foot or feet are then placed in orthotic shoes worn 23 hours a day for 3 months, then nightly until age 5. The child may also need a minor procedure that lengthens the Achilles tendon. Question 11. Which of the following is a sign of an asthma attack? A. Expiratory wheezing. An asthma attack is a sudden worsening of asthma symptoms, caused by the tightening of muscles around the airways, resulting in bronchospasm. During the asthma attack, the lining of the airways also becomes swollen or inflamed, and thicker mucus, more than normal, is produced. Wheezing occurs during expiration because of impaired air movement from constricted edematous bronchial lamina. Respirations may be difficult, but the rate is typically normal or rapid. Question 12. Parents bring their 4-year-old son to the emergency department. They report that he seemed to be improving from an infection but has suddenly become much worse. The provider suspects sepsis. Which of the following is one of the first signs of pediatric sepsis? A. Confusion. Sepsis is a potentially life-threatening condition for children. One of the first signs is confusion, disorientation, or dizziness. Other clinical manifestations include tachycardia, shortness of breath, pale or clammy skin, chills, either a fever or a low temperature, pain, a rash, weakness, and inability to eat. Diarrhea is not a sign or symptom of sepsis. Question 13. After a cesarean section delivery of a healthy boy, the nurse knows that he will be observed carefully, because he may be at risk for C. Breathing difficulty. Wither and NBSB, cesarean section, C-section, delivery and NBSB, babies and NBSB, don't and NBSB, get and NBSB. This may mean that they experience and NBSB, difficulty breathing or coughing up extra fluids during the first few days. Cold stress occurs when the infant is not dried and kept warm. All neonates are dried and placed under a warmer. The other options pose no greater risk for C-section babies than for those born vaginally. Question 14. A pediatric patient has been admitted to the unit with a diagnosis of right lower lobe, RLL, pneumonia. When auscultating the RLL, which sound should the nurse expect to hear? B. Crackles. Crackles would most likely be heard because this would indicate fluid in the airspace. Fluid in the airspace is consistent with pneumonia. Wheezes indicate a narrowing of the airways. Stridor is an emergency lung sound that is heard in airway constriction that can lead to complete closure. Rhonchi is heard in mixed-issue airway constriction and secretions. Question 15. A mother brings her 3-month-old infant to the pediatric clinic for a routine checkup. She tells the nurse that breastfeeding has gone well until the past week. She doesn't seem to be producing enough milk to satisfy the baby. What is the nurse's best response? A. Nurse more frequently during these growth spurts. Infants commonly have a growth spurt at about 3 months, so more frequent feedings will stimulate milk production. Solid foods are generally not introduced until 4 to 6 months of age. Supplemental formula and restricting feeding times will not increase the mother's milk supply. Question 16. The parent of a child with a short leg fiberglass cast phones the clinic because the child complains of constant itching inside the cast. Which intervention is appropriate for the nurse to suggest? B. Tap on the cast at the itchy spot. The most common complaint about wearing a cast is the itching sensation. Clients should never use an object, pencil, ruler, chopstick, etc., to reach into the cast. This could break the skin and cause an infection. Powders and lotions are not recommended either. Appropriate interventions include locating the itch and tapping on it from outside the cast, blowing cool air from a blow dryer into the cast, and wrapping a watertight ice pack or a sealed bag of frozen vegetables on the outside of the cast to cool the itchy area. Question 17. A new preschool teacher tells the nurse at the daycare center that the 2-year-olds argue over toys and refuse to share. The nurse should explain to the new teacher that B. They don't yet understand the concept of sharing. Toddlers do not play together with other children until they are at least 3 years old. 2-year-olds may play side by side, called parallel play, watching each other. Providing the same toy to 2 toddlers can prevent arguments. Separating children or taking away toys are not appropriate actions. Question 18. A parent takes their 6-year-old child to the emergency department at 0200. The child's signs and symptoms are as follows: temperature 103.4 degrees Fahrenheit, difficulty swallowing, absence of spontaneous cough, stridor on inhalation, drooling, and restlessness. The parent says, "This all happened so quickly." These clinical manifestations indicate which of the following acute conditions? C. Epiglottitis. Acute epiglottitis is a potentially life-threatening inflammation of the epiglottis, blocking the flow of air into the trachea. Symptoms in children include fever, severe sore throat, absence of spontaneous cough, difficult and painful swallowing, drooling, anxiousness, restless behavior, and stridor on inhalation. Onset is within hours. Tracheitis is an infection of the trachea, usually following an upper respiratory infection, URI, such as a common cold. Initial symptoms include cough, runny nose, and low-grade fever. Spasmodic croup comes on suddenly, often in the middle of the night. Symptoms include gasping for air, stridor, a barking cough, and hoarseness. Fever is uncommon. Laryngotracheobronchitis is the same thing as croup. Question 19. A mother with a 3-year-old who has a diagnosis of autism meets with the nurse at a day care center prior to the child's enrollment. The mother and nurse want to educate the staff regarding appropriate activities for the child. What is the priority for the nurse to convey to the staff? A. Activities should be focused on safety. Children on the autism spectrum are often unable to identify dangerous situations. They may also have sensory perceptual deficits. The staff must be alert for activities that could injure the child or that provoke frustration or abrupt change in routine. Verbal communication and social interaction may also be goals, but the priority is the child's safety. Remaining indoors is not a priority. Question 20. A 15-year-old male asks the school nurse for information on safe condom use. Which of the following statements should the nurse emphasize? D. Leave a half-inch space at the tip of the should be applied after the penis is erect. When applying the condom, a half-inch space should be left at the tip to collect the ejaculate and prevent tearing. Condoms should be stored in a cool place because they can be damaged by heat. Petroleum jelly weakens a condom. Mineral oil can destroy a condom within 60 seconds. Question 21. During a routine clinic appointment, the nurse checks the vision of a 7-year-old child. The nurse tells the parents to follow up with an optometrist because the child seems to have myopia. Another term for this is D. Nearsighted. Myopia is the medical term for nearsightedness. Farsightedness is the common term for hyperopia. Strabismus and NBSB, or tropia are the and NBSB, medical terms and NBSB, for and NBSB, an eye and NBSB, condition commonly called wandering eye or cross eyes. Amblyopia is the term for lazy eye. Question 22. The parent of a 2-year-old calls the pediatric clinic after discovering the child has ingested some lye-based cleaner. Which of the following is the nurse's correct recommendation? D. Give the child water to dilute the poison. When a caustic substance is ingested, water or milk should be given to dilute it. Vomiting should not be induced. Vomiting would expose the esophagus to the substance a second time and risk aspiration as well. Taking the child and the substance to the emergency room interferes with essential immediate action. There is no indication here that the child has stopped breathing. Question 23. When educating parents who intend to bottle feed their baby, the nurse teaches them of the risks of propping the bottle. Besides choking, what other risk should the parents be aware of? D. Otitis media. Otitis media is a risk because the eustachian tube is short and straight in infants. If the formula collects at the back of the baby's throat, it can produce bacteria that can enter the middle ear via the nasopharynx, resulting in an infection. Tonsillitis is the result of pharyngitis. Sialadenitis is infection of the salivary glands, usually caused by Staphylococcus aureus or mumps. Conjunctivitis is an eye infection and is not associated with propping the bottle. Question 24. A pediatric nurse is caring for a 9-year-old girl with a diagnosis of medulloblastoma. Which of the following should the nurse report to the child's provider? D. Confusion about where she is. Confusion or a decrease in the level of consciousness is an early sign of increased intracranial pressure, ICP, and should be reported immediately. Vomiting can also occur with ICP, but it is not related to food. Concentrated urine is a sign of dehydration. A blood pressure of 108/71 mmHg is in the normal range for a 9-year-old. Medulloblastoma is rare but the most common cancerous brain tumor in children. Question 25. A pediatric nurse is educating the parents of a child with a new diagnosis of asthma about recognizing food triggers. Of the following, which is most likely to cause an allergic reaction? D. French fries. Food allergens commonly associated with allergic reactions in asthma include wheat, eggs, dairy products, citrus fruits, corn, tree nuts, and chocolate. Foods fried or cooked in omega-6 oils can trigger an allergic response. Food allergies can be dangerous for people with asthma. Banana